As one of the most frequent severe and disabling disorders, depression has become a common condition with significant and often unrecognized impact on employees and consequently their employers in all EU member states. Major depression ranks among the top 3 causes of disease burden. Depression is one of the major challenges that occupational health and safety legislation will have to overcome in the future. The policy recommendations on depression in the workplace were published in October 2013. With the European elections approaching rapidly, it is high time to consider best ways to address this crucial health issue in the next European legislative term.
I think networking is one of the very important things, but for example, more using the social media for awareness raising, as well as, for example, insurers who stimulate by for example, giving reductions on proven effective interventions might facilitate dissemination and use of good practice as well.
All our policymakers, of course, and we need to be talking about that, are saying that obviously people should be in employment, they should be working. That's absolutely right. We have a lot of studies that show that employment is good for us. But when we're exposed to a working environment that is not ideal, actually, has the worst working conditions in terms of psychological and social aspects. I'm not talking about harsh conditions here, right? What we see is that their mental health improves when they retire. That argument might be then that, well, actually, for these people, it might be better not to be employed under these specific conditions always, right? Not in general. We do not have direct reference to, for example, psychosocial risks in the workplace in that legal framework, and we have some limited reference in relation to mental health in the workplace. But a lot of the stakeholders feel that there should be much more specificity in the legal framework.
On one hand, we are more confident because we know that the level of awareness is much higher. But on the other hand, we are as well aware of the fact that much more needs to be done at EU and at national level as well. But in any case, another element that we have learned in this process is the crucial importance of providing companies, and in particular micro and small enterprises, with practical tools. Because, as it was already mentioned, I think it was Professor Leka, the issue is not only to address the disease itself or the problem of depression itself, is to act in the prevention of the factors leading to the disease before it appears.
National governments can really help by setting up mental health commissions who would have responsibility for things like ensuring all stakeholders understand their role and the possibilities of intervention, creating educational materials, fostering communication between health and employment policymakers, because we need to break down the silos. This isn't just a health issue, this is a social issue, it's a workplace issue. I firmly believe that the most important policy recommendation is prioritising depression in the health and safety legislation, because we need to take depression out of healthcare policy and put it firmly into the workplace environment.
So we bring together all kinds of self-help groups, patient-driven groups where the patients take an active role in their organizations, all from Europe. So self-help groups, peer groups, run by patients with professionals. But we all bring them together, exchange good practices, and want to spread their word, make their voice of patients heard in different policies.